So I just done a session on the use of neuroimaging in multiple sclerosis. And I think this is something that we feel fairly comfortable with, but what my session aimed to show is that actually by using the tools that we have, MRI, in a more sensitive manner, we can actually really understand people's multiple sclerosis better. And I give a few examples to show that. I show how MRI can help with the diagnosis and the differential diagnosis of multiple sclerosis, and we go through a few cases. Then we look at a case where MRI was able to diagnose multiple sclerosis very early, but also look at the things on the MRI scan that might help predict the risk of further relapses and help the patient and I make better treatment choices based on that information. Thirdly, we look at how MRI can be used to monitor patients on treatment, both to see if treatments are working for patients and identify patients in whom the treatments we don't feel are working and more aggressive treatments are needed. And also to try and keep patients safe on treatments, particularly looking at complications like PML. So the session was really interactive, and I was really pleased. There was lots of feedback from the delegates, and together we worked out between us how best we use MRI in our daily practice. At the very end of my session, we talk a little bit about what's maybe coming in the future. We talk about ways of measuring neuroaxonal loss via brain atrophy, and also some other techniques that may at some point be used clinically, including diffusion tensor imaging, sodium imaging, and imaging of grey matter lesions. So what I hope people get out of this session is that MRI is a really useful tool to help you make diagnosis earlier, to be specific about your diagnosis, to identify the right patients for treatment and identify the right treatment for them. And when you've got your patients on treatment, to be able to really carefully monitor them so you make sure you've made the right treatment decision and that your patients are safe.